Anyone from the walkway wants to come in and rest your feet, please feel free.
We'll solve your data management problems right here in the next 5 minutes.
All right. So as we think about data management, this is no shock, right? But data is very critical and also kind of a mess. It's very complex. There's unstructured data, there's structured data. Nothing talks to each other. I think we all know the pains of those systems. And really, as we grow those systems, we need to make sure that governance and management is in place from the start, or you're just going to be feeding bad data in and getting bad data out. So there's always going to be trade-offs, right? We're never going to say any system is perfect or complete. There's always going to be give and take. But the goal is to make sure that that give and take is known and transparent, and we can make intelligent business decisions to ultimately guide the correct patient care. To support that, really simplify, 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 right? So simplify schemas, more intelligent visualizations, and really transparent traceability to make sure that you always know what's going in and why and where it's ending up on the back end. Steph?
Awesome. So all of that's easier said than done. The healthcare industry is producing about 30% of the data that's produced while we have this talk is from healthcare activities. And based on what's going on in this room, that's probably that proportion is poised to increase rapidly. So how do you manage that? How do you not miss out on potential value that you don't even know is there yet? But also, how do you balance having a quality data asset that your end users and consumers of the reports and the insights that you generate can trust? So obviously, super difficult, but we've tried to boil it down into 3 kind of guiding principles to help you manage how you strategize about your data management strategy. So the first one is don't confuse data analysts with data managers. This kind of goes without saying and is pretty self-explanatory, but we see, especially in a resource-strapped environment, we see organizations try to hire a data analyst who's also going to be a data manager. Data managers, and we find organizations that are successful in their data management strategy really structure their teams to have dedicated resources to the job of data management. And when we talk about data management, we're thinking about, having a pulse on what sources are available and how you might bring in those sources to your data landscape, and then thinking about having a pulse on data quality to make sure you're building a quality data asset. Whereas analysts will hopefully take the output of all of that work you're doing and draw insights from the data asset that you've managed. When we have organizations that kind of conflate these two or try to have folks wearing multiple hats, the data analysts spend so much of their time cleaning data, wrangling data, that less time is spent on actually deriving those important insights. So whenever possible, really try to structure your team such that you have dedicated data management and dedicated data management policies that are separate from your data analysts. They should work together. There should be a symbiotic, cyclical relationship between your data managers and your data analysts, but having dedicated data management resources is important. Second, you don't need to integrate everything, and you don't need to do it all at once. And I'll add, you don't need to do it in the same way. So boiling the ocean here is where you are risking being on the wrong side of that trade-off between data quality and data completeness. So the data management, one huge task of your data management team is to think about what is the universe of data resources that I have available? What is the known value? What are those core data sources that I need to integrate? And a lot of the organizations we work with think about claims data, clinical data from EHRs, but also more broadly, what's possible, what could have value down the road, and how can I integrate that? And any modern lakehouse platform is going to allow you to integrate data in kind of different levels of hardness. So you have those data sources that are core to your data strategy, like EHR data and clinical data. Those you would want to pass into a unified data schema, those things that your end users are really going to rely on. But you also may have, data sitting in a closet that you're not sure that you might need in the future, but you don't want to miss out on the potential power. The lakehouse platforms are great for that. You can store that raw and structured data. Your teams can start to analyze that data, kind of make sense with it, and if there's potential value, promote that into your data schema. emphasize the quality of that data so that it's ready for prime time. And then the third point, building data trust should guide all of your decision making. I think this stems really nicely from the first 2 points, but if you've built a really thoughtful data asset without attention to quality, one bad interaction with bad data from any end user is going to kill all of your efforts. So any decisions that your data management team is making about, what data to bring in or how to structure your team, we should be thinking about quality first at the end of the day.
Awesome. So as we think about lake houses, they're really cool. The technology is amazing, but ultimately you also need that transparency aspect, right? You need to know, when is my data hitting the system? You probably have 30, 40, 50 feeds of data. And so this is a screenshot from one of our console products, which is really just a way to say, we want to tell you where your data's at every step of the way. Not so we want to put the responsibility on our customers to fix it. That's not the goal. The goal is we hold the responsibility to make it right, but you need to know what's happening. If someone logs in on a Friday and you don't know that a claims feed didn't process because, I don't know, a payer changed a file format for the first time in history, they're not going to know why their data is wrong. So you need to make all of that transparent. This includes some basic things like, what is your file? What's the type? When did it hit the system? But also, what delinquency tolerance will you accept? So going back to Stephanie's point around there's always business decisions and trade-offs. Some data, if it's a little late, it's probably okay, right? It's not ideal, but it's not the end of the world. Other data, if it's a day or two late, that's really going to affect your providers and your patients. And so you want to make sure that those dates are customizable to your source and to the files that you're looking at. The right-hand side of the screen is just showing, what's going on, right? Nice, easy graphics to say, good, oh, there was a problem here. This is what we're going to dig into. This is what we're going to alert you about. This is what's happening with it.
Yeah, I think that concludes our conversation.
Yeah, I thought there was one more slide. I missed it. All right.
But yeah, I think, obviously we could talk about this for days. We're biased. We think Arcadia is a great partner to help be a partner in your data management strategy to provide those transparency tools that Christine talked about. But, data management and dedicated data management resources are really going to be the core to success in harnessing all the data that's getting created today.